policies and programs in India, the theme which have been selected for today. In this this presentation, in next 30 or 40 minutes, I'll be deliberating on following aspects. I'll start with the policy and health policy, the conceptual understanding. Then I'll quickly touch upon policies and their relationship with the laws and regulations. I'll reflect about the policy triangle, National Health Policy 2017. I would like to introduce two concepts which you may or may not hear in the time ahead, but those are so very relevant for India's health sector. The concept of universal health coverage and health systems. And of course, then we will follow by questions and answers. Directly coming to the health policy. What is a policy? So I'm sure you would have been here reading and learning about policy, but there are different approaches to approach this area. So policy is a set of ideas or a plan of action to be followed by a government. But a policy can be also for private sector or a policy at any level. But here we are talking about policy in the context of government. So it's a set of ideas or plan which government agree to follow. In more simple terms, policy is what government choose to do or not do. So the point is, yes, if government decide to not to do something, is also a policy of not doing something. So any action, any intervention made by government is a policy, whether they are stated explicitly or implicitly. In health sector, we had India's first national health policy in 1983. We will talk more about that little later. But in addition to the policies, there are other instruments in health sector, like 5-year plans, which were there in the erstwhile planning commission. There were 12 5-year plans in India. They are also planned, though theoretically they are said plans, but they are policy of the government. We'll discuss about that in more detail. And there are success reports and other aspects. So that's a broad definition of policy. And all I would like you to remember is that anything which government decide to do or not do is also a policy. If they decide not to take any action, the government decide not to say something, not to speak on a topic, that is also a policy. More specifically on health sector, what is health policy? So health policy, if we start understanding, is a mandate and something which usually public authority or government publicly say in an authoritative statement of intent that what they want to do, what they want to follow is a policy. But if we go by definition, WHO say that the decisions, plans and actions that are undertaken to achieve a specific healthcare goal within society. So here we need to remember one thing, and that's what I would like to highlight. Policy need not mean a document which should be available. Even a government order is government's policy. Even without being written, if government start doing something or following a particular approach, it is a government policy. So government's decision, which may not be stated as a policy, but their decision by the government are also their policy. The plans, actions. So as I said, that 5-year plans are also policy. And even without anything written, any action which government take is government's policy. The idea of health policy that these defines the health goals at any level, be it international, national, local, or state level. And these goals have a specific about the decisions taken, plans made, and actions to be undertaken during this process. So that's what health policy is. Now, I will not go into many details, but what we need to remember that a health policy can have various subtypes. Like it could be healthcare policy, which is focused solely on medical care, but it could be a public health policy which focus upon keeping people healthy. So there can be multiple ways, and just remember that there are various dimensions. So the next slide show exactly that. So health policy can also be looked around in another approach of global policy, like which are related to international health related aspects, or if an international organization work and that's a global health policy. But public health policy, which is focused upon public interventions, preventive promotive healthcare services, mental health care policy could be there, insurance policy, personal healthcare policy, pharmaceutical policy, healthcare service policy. So it can be broken into many sub-pieces, but all of them put together are health policy for a nation. Now, coming to India, India started on various health policies well before independence. Yes, that's true. But the question is, like, India had the India country's first national health policy, which was released in 1983. And since then, there are two more policies. Second national health policy came in year 2002, and then third national health policy came in 2017. We will talk about national health policy 2017 little later. There is no life cycle of policy. Till the previous policy is replaced by the new policy, that previous policy is always in existence. So no policy does not have a time limit that it is for 5 years or 10 years. Currently, we have policy, which is third policy. It started in 2017. Till a new policy comes, this policy is enforcement. But then question arises, if India had its first national health policy in 1983, then what were the policies before 1983? As I said earlier, policy document need not to be named as a policy document. So one of the key policy document for India has always been discussed and relevant. Like, it is one of the most discussed or mentioned or cited policy document is a Bohr committee report. This Bohr committee, Sir Joseph Bohr was the chair of this committee, and that's how this committee is known. Was constituted in 1943 with number of members, and this gave India as one of the first most detailed and comprehensive recommendation on how to transform India's healthcare system. This committee submitted a report in 1946, and some of the recommendations were really futuristic. What this committee suggested, Sir Joseph Bohr committee, was very much aligned with on something similar principle on which United Kingdom launched their National Health Services, NHS. So Bohr committee report is one of the key policy documents from the beginning. Since then, India has also a number of committees which were constituted on regular basis, and those committees gave recommendations on various aspects of health services. And subsequent governments started following those policies. So I have a slide. Next slide shows the various committees. We will not go into details in the interest of time, but you will get a sense that regularly high-level committees were formed and which gave recommendations which were utilized to formulate policy. Then India had a Central Council of Health, and subsequently which was called Central Council of Health and Family Welfare. This is a council of members of state and union level. Central Union Minister of Health and Family Welfare is the chair of this council, and state ministers of health from all states are member of this council. So this is the highest decision-making body on health in India, Central Council of Health and Family Welfare. So this is one subset. Then Directorate General of Health Services is a technical wing in Ministry of Health, which also formulate policy, and of course Ministry of Health and Family Welfare. Any directive coming from them is a policy. So there are many mechanisms. So policy is one instrument, but we need to remember that health policies are formulated by different arms and different processes. As I said, erstwhile Planning Commission, now we know as Niti Aayog, used to release 5-year plans for a 5-year duration, which had all the sectors. These were the development plans for the country, linked with the financial allocation for the state government and different level. So 5-year plans were also a tool to formulate policy, and health was one of the key components. So India had multiple instruments to formulate policy. Now, as I said, that there have been a number of committees, and you can quickly go have a look at these committees that which were formed over a period of time. Very regularly, they gave a very specific recommendation which government followed, and then subsequently another committee came up. And this process continued to happen. Even in 2010, this slide did not capture that, but even in 2010, India formed a high-level expert group on universal health coverage, which submitted its recommendation in 2011. So there have been committees on regular basis. Now, what influences the policies and how policies are formulated? I would like you to remember one thing. There is something called policy triangle. So the policy formulation, what policy will emerge and what will come out, is influenced by 3 factors, and fourth, which is interlinked with the 3 factors of content, context, and process. And of course, actors, individuals, group, organization interplay a role in this process. So for example, in the context, Whenever a particular policy is formulated, it depends upon what is the context, like what is happening around that point of time. For example, 1983 policy was formulated because in 1978 at global level, there was a discourse on primary healthcare that which recommended that all countries should come up with the idea of what they want to do in health sector, and that's how India formed the policy, national health policy in 1983. Similarly, the new policy formed in year 2002. So 2000 was year 2000 was a new start of new millennium, and a new government was also in power. Bharatiya Janata Party led government came into power, and they decided that they will formulate policy. So there are some changes in the context, and that's how the policies are formulated. Even in 2017, the third national policy formulated, because then also the NDA government and BJP came into power, which in 2014 formed that they will have a new policy. So there is always a context why a policy is formulated. India launched a National Rural Health Mission after 2002 policy. So the policy was formulated, that is usually followed by some programs to implement those policies. So National Rural Health Mission was launched. National Urban Health Mission was launched because of 2002 policies. There is always context. As I said, 2017 policy formed because new government came into power, which had promised some of the things, and policy was formed. And that resulted in the launch of Ayushman Bharat program in 2018. So policy, programs, and then implementation, that's the process. But 2017 policy also formed in the context because at the global level, the Millennium Development Goals, which were formed in year 2000, completed their tenure in 2015. And then Sustainable Development Goals came up, and there was a health goal 3, some attention. So the multiple factors plays a role in formulation of policy, and the context set the context for policy formulation. The NHP, National Policy Health Policy 2017, also had a universal health coverage focus, which we will talk in brief later on. And this started much earlier, but National Health Policy has central goal which is aligned to UHC. As I said, that 2017 policy formed in the context that government which came into power had promised to have a new program, new policy, proposed National Health Assurance Mission, and this was outcome of that. But policy process is also a really long process. It took nearly 30 months and series of consultation before this national health policy could be released. And as I said, the Ayushman Bharat program was launched. Then comes the second part, the content. What would be the content of the policy? It is influenced by the people who are involved in the policy making, what they believe and what they think. So their experience, the available evidence provided by technical expert, and their own understanding of the needs of the people. Like if they are exposed to the challenges people face, then policy will be people-centric. So the content of any policy is determined by the people involved in that policy, their experience, the evidence they have, and understanding. Then third thing, a process. Process could be dependent upon various aspects, but usually it's aspirational, evidence informed, evidence are collected. Like initially somebody need to outline that we need to formulate policy, then evidence are collected, consultation are done, a draft document is prepared. So India's draft national health policy was prepared in 2015. It was put into public domain for public comments, and nearly 6,000 public comments had come up on that policy. But even after drafting of the policy, it took 18 additional months before policy could be released. So it's dependent upon many factors. And policy formulation is not end of the process. Then policy should result in program formulation to make those policy implementable and then scale up of those programs. Then we come to the policy triangle, and the central theme, central part of it is actors and stakeholders. It depends upon who are their policy, what is the level of interest, who are the people involved. If there are individuals who are influential and who believe that India needs a new national health policy, and then if they can tell the right kind of people at the right time to do that policy, and it happens. For example, as I said, that anything which government does a policy, that in Delhi, a new government came into power and they believe that poor people should be having access to a better healthcare service, especially primary healthcare services. And that's how Mohalla Clinic of Delhi was formed, because there were government and people who believed in particular thing. the Delhi has a mohalla clinics to provide healthcare to primary healthcare to poorest of the citizen. Those facilities are located to the poorest of the citizen. Then Hyderabad in Telangana has Basti Davakhana, and those were found because some policymakers from Telangana visited Delhi and they were impressed with the mohalla clinic and their performance, and then they went back and they found the Basti Davakhana in their setting. So it depends upon the time, place, person, and their level of interest. The stakeholders are very important. Sometimes policymakers or politicians take their own a decision. Sometimes other stakeholders and influential citizens need to tell them that do something. How it will happen, we really cannot predict, but that's how it works. Another important thing to remember is it's not a linear process. We should not think that this will happen, that will happen, and that's how policy will be formulated. At times, dialogues start and never fructify. At times, it can happen very quickly. So it's not a linear process. Linear are only books. Like books tells you theory that this will happen, that will happen. In real life, they are very different. Sometimes policy and its impact may take 5, 7, 10 years, even longer. We really do not know. And then implementation takes its own good time. Any policy decision, which is, at least in health sector, before it reaches to citizen, it takes 2 to 3 years. Now, I'll try something to speak which you already are studying. I'll not try to explain law or regulation to you, but I'll try to bring a linkage between policy, law, and regulation. So essentially, law is a policy with a legal mandate. So we need to remember policy are formed first, and then policy idea are precedents for law making. I'm saying repeatedly that policy idea does not mean that it's a written document. Policy idea means a policymaker think something should be done. Even a piece of paper is a policy. So policy idea results in the law making. Law have a more controlling authority, as you all know. Policy doesn't have that force of law. So law is required if you want to enforce. You want to be more directive in an approach and in legally enforced approach. So law are directive, clearly outlined, then drafted, and always approved by the legislative body. Laws are passed by elected officials, often enforceable to be implemented effectively, to be a particular approach implemented effectively. Policies are not binding on the government. Government can form a policy. The executive of the government, the bureaucratic part of the government can form a policy. It need not to go to the parliament or assemblies, but laws need to be approved by legislative body and elected leaders. So that's a key difference in policy and law. The other dimension, which I'm sure you would be studying more in detail, but is regulation. So regulations are operational approaches to law. And I'm discussing this in a more simplistic terms in context of health, and then I'll give you an example that in health, how does it work? A specific example. So regulations are rules, orders, and detailed guidelines which are within the law which is enacted or formed, that specify how a particular idea need to be actually implemented at the ground. So laws are formed by legislative, but the regulations are detailed by authorities or executive to keep system regulated. One of the key difference in law and regulation is that law can be amended only by legislative, but the regulation can be modified through a feedback from citizen or by the executive only. So need not to go to regulation, need not to go to higher level or legislative. If we start thinking of policy and regulation, regulations are specifically administrative process. Policies are more general guiding approach or achieving goal. And policy making, as we say that policy idea are precedent for lawmaking, and lawmaking results in regulation formulation. Regulations are made by executive branch of government. Policies are made by usually higher level in the government, but can also by organizations, individuals, which are non-governmental policy. Regulations are usually restrictive in nature, impose sanctions on people. They are very specific and details. If we put all three together, and then I give you an example of health sector law, that's a Clinical Establishment Registration and Regulation Act 2010. This act outlines that when health facilities being set up, what all should be part of this. So India formulated a national health policy 2002, which which mandated the need for regulation of healthcare services in the country. The idea of regulation is because India has a mixed healthcare system where private sector is there, public sector is there. And in any sector, to ensure that people receive quality healthcare services, people are not overcharged, and other aspects, the health services meet the minimum standard, the law is required. So that's why the need was felt in National Health Policy 2002. Then it resulted in the law formation of Act of Clinical Establishment Act, and then Clinical Establishment Act was once cleared by Parliament. The regulations were framed in 2012, and that's how it works. I borrowed this image from internet. So this image gives a linkage, and it's a good explanation of interlinkage of policy, law, and regulation. If the policy, like seeds we plant, and the root or foundation, then the law are the trunk on which the body of a tree or branches of the tree stand. So tree are like regulation, laws are like trunk, and then the roots are like policy. So that's a fairly good description, though people can come up with their own description. Now coming to the last two parts, and one is the National Health Policy of India. So India formulated National Health Policy 2017. This is most recent one. This is one of the first policy which had come up with a detailed situation analysis document. In this document, government say that what is the situation of the health sector in the country, and what are the challenges, and based upon those identified challenges, Indian government formed National Health Policy, which outlines what should be done and what it plans to do in the time ahead. Let me give you some deep dive into National Health Policy 2017. So this is a third policy, as I said earlier. In between, the various 5-year plans and committee reports were there. But we should also remember that though there is a health sector specific policy, but all the policies should be seen in consonance as complementary to each other. So there are a number of other policy documents which should be read along with the health policy. So National Policy on Rare Disease, which was released in 2021, this year only. But even before National Health Policy, National Mental Healthcare Policy, 2014 National Pharmaceutical Pricing Policy, National Vaccine Policy, National Health Research Policy, National Youth Policy, National AIDS Prevention and Control Policy, National Blood Policy, Population Policy, Nutrition Policy. So you see that nutrition policy there since 1993, and there is no new policy. So that's the current policy of the government in the matter of nutrition. So there are policies, each one complement others. But not only the health sector, even though we are talking about health sector, there are policies of other sectors which have a direct or indirect, or rather indirect linkage with the health sector. And so water related policy, environment, housing, air pollution, habitat, all of those policies should be seen together in consonance. In addition to the policy, the government on regular basis enacts some law, and we have already discussed what is the benefit of law, which are legally binding, enforcing. So National Mental Healthcare Act 2017, HIV/AIDS Act 2017, National Medical Commission Act. So there are many documents which works as a policy. Everything put together makes policy. Though there is one National Health Policy document which is called National Health Policy. In addition to this, whenever any arm of the government release a document, it contributes to the policy. So for example, Niti Aayog released 3-year action agenda in 2017 to 2019, and that's also has a health focus. So any component in that document is a part of health policy. Similarly, Niti Aayog released a 5-year strategic vision for multiple sectors, and 4 of those chapters are on health. So even those documents, so everything put together makes health policy. I repeatedly say this message. What National Health Policy 2017 specifically says, it has a few proposals, and I'm summarizing a few, not all. It proposed a few new institutions such as National Institute for Chronic Diseases. It talks about National Healthcare Standard Organization. It focuses upon National Digital Health Authority, which has already been set up now, Center for Excellence in Nursing and Health Sciences. So it focuses upon setting up institutions. It also talks about Swasth Nagrik Abhiyan, health and wellness centers, public health cadre, mid-level care provider. Just for Your information, while I'm sharing this information, the National Health Policy PDF file is available in public domain. You can Google it and you can find that National Health Policy document will be available. So whenever policy is formed, it has a central goal which is fully aligned with universal health coverage, and I'll say what is UHC, universal health coverage. It has 32 measurable indicators, and the timeline for those indicators is till year 2025. And the policy promised that there will be an implementation framework which will be released, which has not been released. One of the key shifts in the policy is from rogi or from sickness to wellness. That's a key approach. But National Health Policy, I have summarized for you 10 key components of the policy. And this is like policy as central theme of UHC. The National Health Policy talks about strengthening primary health care in the country and preventive promotive healthcare services. It says that at present in India, around 30% of the total health services are provided by government sector. In the policy, it says that the target is to achieve 50% of the total health services should be provided by government. Currently, it's 30% by government and 70% by private sector. Government aim to strengthen health services, primary health care services, to achieve 50% of the total services by government and remaining 50% by private sector. It also says that to achieve primary healthcare strengthening of the total government spending on health, 2/3 or more should be spent on primary healthcare. So there are that kind of proposals. We know that in India, then third point, we know that in India, the non-communicable disease, diabetes, hypertension, stroke, cardiovascular diseases, liver diseases, etc., are the major cause of morbidity and mortality. So in earlier times, before 1990s, infectious disease, tuberculosis, diarrhea, and other diseases, infections used to cause major deaths and disability and diseases. But now 2/3 or more deaths and diseases are caused by diabetes, hypertension, the conditions which are not infectious, not transmittable or infectious. So these conditions are new emerging conditions. So new policy talks about that health system should be prepared for deliver non-communicable diseases. It also talks about elimination, eradication of some diseases such as you might not even have heard, lymphatic filariasis or Kala Ajar or Hathi Paon, elephantiasis. So some of these diseases are there. It targets to eliminate some diseases. The National Health Policy also focus upon increasing government funding on health. So in India, as proportion of GDP, the government spending on health is 1.15% of GDP. Now, this is one of the lowest in the world. Yes, this is one of the lowest in the world. India comes in bottom 20% of countries when it comes to government spending on health. So India's National Health Policy proposed that from 1.15% of GDP to it will increase to 2.5% of GDP by year 2025. It is 4 years since then, but it has not increased much. On average, the low and middle income countries, government spend 4 to 5% of GDP on health. In a European setup, around 8 to 10% of the government's GDP, 8 to 10% of GDP on health. So India is really low spender, and that's what government say that it will increase to 2.5% of GDP by 2025. In India, there is another challenge because health is a state subject. So 1/3 of the spending on health comes from central government because central government all have some functions, and 2/3 of total spending on health come from state government. Now there is another value which is only 5% of the state budget on health is spent. 5% of state budget is spent on health by state government. So National Health Policy says that state spending should also be increased from 5% of budget to 8% of budget or expenditure by the state government. So there are that kind of proposals. The National Health Policy also talks about intersectoral coordination on addressing something which is called social determinants of health, SDH. There are like improved water, improved housing, improved sanitation. All of these are called social determinants of health. And experts have come up with the idea that while health sector has 50% control over what will on the health of the people, but improved water, improved sanitation, improved education, improved female literacy, all of these will also contribute to some outcome in the health sector. And those are called social determinants of health. But if we want to address those issues, for example, air pollution control, which is outside health sector in theory, but control in air pollution, especially indoor air pollution, will reduce the respiratory illnesses and it will increase life expectancy. So to achieve that, it's important that health sector collaborate with various other sectors. So that's what the policy proposed. And the next point is also related to that it's not only collaboration or coordination, but establish partnership and engage other sectors in health policy formulation and engage in their policy formulation from health sector. So this is called Health in All Policy approach, HIAP approach, and with this policy proposed. Of course, India has a big private sector, so national health policies say that engage with the private sector. And one of the key principles in national health policy of India is that while government should focus on delivering primary healthcare services, for secondary, especially hospitalization services and tertiary services, government should collaborate with the private sector. And that's how the government has launched Pradhan Mantri Jan Arogya Yojana scheme. One of the key learning from this COVID-19 pandemic is there, but also even before that, to make all of this work, the community should be engaged. Any such intervention should be done with the community. Now, the last point could be of your interest, and in the run-up to national health policy, there was a lot of discussion in India whether health should be made a right, enforceable right in court of law. And finally, in the policy document, health is not a right. And in what policy documents say that India's health system is not strong enough that if we make it a right, it will not be even then it will not be able to deliver services. So it talks about incremental assurance of health services. And it says that once health system is strengthened, maybe right-based approach to health can be considered. So these are some of the principles of national health policy. A number of Indian state government outside this also started thinking of right to health. Madhya Pradesh, Rajasthan, and Chhattisgarh at one point of time started working on right to health, but none of the Indian state has passed right to health legislation. What does a policy mean and what next? Policy is about having a vision. It provides the guiding direction that where we want to go. Policy also gives a societal perspective where we can get an understanding that what policymakers and society should and does want and what we want to do for them. In more specific terms, policy indicate when government write in a document that government agree to be held accountable for what it proposes or promises. But at the same time, we should remember that because these are not enforceable, so being written in policy does not mean it would happen. Alongside, not being written in a policy does not mean it cannot happen. Even without writing in policy, it can happen. So therefore, the role of stakeholders or all stakeholders in civil society, academia is that whatever is written in the policy, we should keep reminding to the government. There are new areas we should tell the government that this is not in the policy, but this is what should be done. So there is an important role of every citizen in ensuring good health for people, including policy formulation and beyond. Moving to the last part, I want to, I'm really passionate for my 10 years of work and has focused upon these two concepts, the universal health coverage and health systems. So UHC is a global concept, though in theory it was there since 1945 and long ago. The national health services in UK are based upon principle of UHC. So UHC says the concept is that all individual and communities, no matter where they are living, every citizen should receive quality healthcare services they need. So health services, but not only health services, the health services which are good quality and as per their need. And then while receiving these services, people should not be suffering in financial hardship. So the concept of UHC has three dimensions: people, services, and financial protection. The UHC also talks about that those services should not be only for those who are sick or only for diagnostic and curative, but services should be, health services means if somebody gives me advice to prevent me from a disease, that is also health service. That's a preventive health service. If we are getting vaccination, that's a preventive health service. So UHC focused that health services should not be only curative, not only treatment, but a broad range of health promotion, prevention, treatment. Some people require rehabilitation services, and some terminally ill cancer patients require palliative care. So that's what government should do. So UHC is really all encompassing. There is a global goal as part of Sustainable Development Goal, Target 3.8, which focus upon achieving UHC. India through National Health Policy has committed to this goal. There is a better way to explain UHC, and this is called UHC Cube, and this developed by World Health Organization in 2010. So as you can see, this is a cube, but this is also a cube within cube. So there is inside cube and there is outside cube. And if you go back to the definition which I said of what is universal health coverage, I said that UHC has 3 dimensions: population coverage, service coverage, and financial protection coverage. So usually inside cube reflect a reality in the setting, in any setting. So inside cube on the x-axis shows that only proportion of population have access to healthcare services. So population covered with services is less than 100%. So outside cube, let's assume is 100% on all 3 dimensions. Inside cube show current reality. So on the x-axis, there would be people who would not have access to health services. So population which is being missed from health services, that's the population coverage dimension. So approach had to be moving this inside cube on x-axis toward the outer cube till all populations are covered. Now one can say it could be inside cube could be 40% population covered, 50%, 60%, 70%. That is not that is immaterial. We should focus upon who is not being covered. So idea should be wherever the country is to go upward till that dimension of box is filled. So that's on population coverage. Any population which is being missed should be covered. That's one goal. On y-axis, the service coverage, usually the limited number of health services are available. And those services are like mostly like mother and child health condition, tuberculosis, and all those. The health services for diabetic, hypertensive are usually not available. So idea should be identifying those services which are not available and then strengthening or improving government services facility to deliver those services. So move in that direction, fill that box that all services people need are available. Third dimension is that while accessing healthcare services, people should not be falling into poverty. Essentially, UHC does not say that health services should be free, but it says that health services should be available within affordable limit, which means for some who don't have a paying capacity should be free. For others who can pay, it should be within affordable capacity. And that's how health services should be designed. Currently, just remember this number. Of the total spending on health in India right now, only 40% it comes from the government. 60% of the total health spending in the country is paid by the people. So when you and I go to a private provider, when I pay money, that contributes to the total 60% of health expenditure, and in a economic and medical term is called out-of-pocket expenditure. So out-of-pocket expenditure is 60% in India as part of the total health expenditure. Now, just remember this number, and globally, there is an agreement that this spending, out-of-pocket payment should not be more than 20%. Most of the countries, European country and countries which have UHC usually have around 10% of the total paid by people and 90% by the government. Even closer home in Thailand, it's around 11% is out-of-pocket expenditure while 89% paid by the government. In India, government spend only 40% and people spend 60%. Essentially, people spend 1.5 times more than what government spend on health. I think I'll stop on this component here, and then last slide is health system framework. And with that, I'll close. So there is another dimension which I would like you to remember, please, which is called, like, you might have heard a lot of discussion on health system, that we want to strengthen health system and India's health system is weak. People talk about health system, but their understanding of health system is really limited, even policymakers. So look at the left side. Health system essentially means if we want a good health for the citizen, it requires a few things. So often we say there is shortage of doctors. but that's only health workforce is only one component. Even if there are enough doctors, health services will not be available immediately. Like people will cannot be treated. If we want to treat people, then there should be in the same facility where doctors are there. There should be medicines and supplies. The doctors and provider need to know which are the common illnesses which are affecting people, and the doctors and nurses need to have the right kind of equipments which can assess individuals. So service delivery, to make those facilities functional, where there is a equipment, where there is a doctor, where there is a medicine, government need to provide sufficient funding, and there is something called leadership and governance. So in interest of time, I would say that health system is much more complex, and I would request you to please spend some time in whenever you get and you are a little relaxed to understand what makes health system. Often government keeps saying that oh, we have given so much of money for resources, but usually health workforce is not there. There are vacancies. It will not work. Even if there are vacancies are filled, if there are no good system for deliver medicines or provide medicines, it will not work. So health system to function really well, we need to have all components. It's like a kitchen in the household. The example is that the purpose of household kitchen is keep everybody nourished in the family. But to cook in the household, and that's like health system does a similar function. We need ingredients in the kitchen. We need gas stove. We need funding or monthly expenditure for that. We need somebody who can cook. You can have a very good kitchen, very modular kitchen with all the ingredients which are required to cook. A gas stove, state of art, everything. But if somebody doesn't know how to cook, it will not result in good nourishment. So ingredients are not enough. You require trained person. Even if trained person is there, you need to have a sufficient resources to that, so that those supplies in the kitchen can be replenished. So that's how health system is. Somebody in the household need to guide that what should be cooked. There could be enough material. If somebody is not told that what to be prepared, and that person should be trained to prepare this thing. So it's more complex. We do not pay attention to our kitchen, that it's really more complex than it is. But the health system is like cooking at the entire nation or entire district or entire state, which makes it more complex. This is a concept which I speak for 45 minutes and take lectures, so I know it's a little complicated. Just remember this image and please read about health system, and that will be really helpful. So with this, I would stop here. Thank you very much. On the left-hand side is a book I co-authored. That's the image of that book, co-authored with two of the leading experts in India. I stop here for question and answer. Thank you very much for your kind attention.
Thank you so much, sir. I just wanted to tell you one thing. Chapter 1 of your book is one of the readings for this course on public health law.
Okay.
So they have already read at least the ecosystems part when we discuss about ecological health. So your chapter on ecosystems and viruses, that forms a basic reading for their understanding. So as lawyers, we lack knowledge on the medical side and how systems work. We can't make laws or policies for that matter unless and until we know what this ingredient is. So even you took the example of the kitchen. If I do not know what this stick is, I'll just throw it out. It might be a cinnamon or a vanilla stick. We need to know what it is to cook. So that's why this lecture, and through this lecture series, we want to invite more of public health experts from the medical side who can tell us about these basics. I'm sure my students would have enjoyed your class. It was very interesting. The analogies you drew and the ways in which you weave a seamless fabric of how pre-1983 and post-1983 government has been framing national health policies and how they have been implemented or they might not have been implemented. I open the floor to questions. If there are any questions from the class, please raise your hands. We can go one by one. Rishika has a question. Yes, Rishika, go ahead, bache.
Hello, sir. Good evening.
Hi.
So my question is, right to health has been recognized as a fundamental right in India. So do you think that since the government needs to implement right to health, health should only be a public good or a private good? In the sense that only the government should be responsible for health, or should there be private sector as well? or is there no need for a private sector because it is a public right?
Well, so the right to health is not a fundamental right in the country. So as of now, whenever it comes to right to health, the various courts have made it interpreted in context of Article 21, right to life, and Article 47, where they say that the state responsibility of state to provide good healthcare services. But a right to health per se has not been articulated in the constitution of the country. There are some laws and judgment which have said that it should be interpreted, but that's a part of the interpretation. A number of state governments have started thinking in that direction, but none of the state has either worked on or fully succeeded. Coming to the second part, whether government should provide the health services fully or private, what role of private sector is there. So India's healthcare system has evolved as a mixed healthcare system where private sector is an integral part of health service delivery. So the best approach to ensure accessible, available, and affordable healthcare services is that government increase its own facility and services provided from government facilities. Since government services are free, they will become accessible, affordable. For private sector, just to ensure that they do not overcharge or it does not result in exploitation of citizen, and also to ensure that quality of those services is good, the regulatory mechanism is followed. So those are the approaches. The best approach to ensure, even whether there is a right to health or not, best approach to move in the direction is that strengthening government healthcare facility, then ensuring that health services are available from government facility. There is experience from a number of states that the best regulatory mechanism, best mechanism to ensure that health services are accessible, that government increase provision of those services.
Thank you, sir. Any other question by any other student? Otherwise, I have a couple of questions. Okay, I'll ask in last. Nishtha has a question. Nishtha, go ahead, bache. Nishtha, you're not audible in case you're speaking.
Hi, good evening. So sorry, I had some problem connecting to the audio. Sir, my question was with regards to the health system that you talked about. You told us very briefly mentioned about the 6 building blocks of a effective health system. So I wanted to ask that in your opinion, is there any one block which is more important or forms the foundation of all the other blocks? Like are the other blocks built up on some one particular block, or are they at an equal level when we look at a health system?
So on the left-hand side, what we call is health system building blocks or functions. These are the name given to those 6 components, building blocks and functions. These are repeated functions. And each one of them is important. None of them alone will work. So they are equally important. There is nothing like one is superior and one is more. For example, if there is no health workforce, you cannot achieve other, like the medicine, availability of medicines, diagnostics, and vaccines at the facility will not do good. If there is no health information system where we do not know what are the common illnesses in the people, then even medicines and the health workforce will not be able to do. So each of the function is important. You can have everything. If there is not sufficient funding, health services cannot be expanded. So health financing, human resources, all of those are equally important. Of course, one of the things which we need to remember, because India has three subgroup of health. Like if I ask people how many health systems India has, and Nishtha, you want to try how many health system India has?
So because health is a state subject, so we have, like, I would say national, state, and district level.
Very good. I'm proud of you. This is a perfect answer. So it's a national health. If we look at the political boundary of national level, then one health system. But if we look at the state level, then India has 35 or 36 healthcare system. If we district level, India has 700 odd district healthcare system. So in each of those system, what need to be done? We need to examine from health system. This is framework. Frameworks are tools to think. So we need to see that what are the strength and weakness in each of the 6 building blocks in that setup. So in some setup, we might need more attention on health workforce. In other setup, there could be more need for more attention on medicines and supplies. But each one of those 6 are important and they are there. But whichever is weak in that setup need to be addressed. That's one. Second part is that government may choose that, okay, in the beginning, we want to focus on health workforce. Subsequently, we will focus upon ensuring supply of medicines for a facility. Subsequently, we will so approach to tackle them could be very different, but it's important that all of those 6 work in a tandem.
Thank you, sir. Sir, if I may just follow up on one thing. So what you're essentially trying to say is that the leadership and governance component of it really provides a direction to how others work in tandem.
No, it's an integral part of it, but just because it's listed as first does not mean it's the most important. Right. So it's one of the components. Each one of them is important. In some setups, for example, in a particular state, there is a sufficient manpower, there is a medicine supply, government funding is there. And even then health services are not available to the people, then leadership and governance function has 3 roles. It's called steering, not rowing. Like when you do boat or so you steer, you give a direction, but you do not do it yourself. So it has 3 components: so policy formulation, the regulatory system, and then generating data and sharing that data and intelligence. So these are the 3 functions of governance. So government leader will direct that, okay, we want to have a stronger primary healthcare system. Accordingly, he need to assign or allocate resources. Accordingly, the human resources need to be deployed. The policy need to be formulated that whether we want to have more of a hospital or we want to have more of a primary healthcare facility in rural areas. So each one of them is important. But definitely, in the at some point of time, it comes down to policymakers because they are the ultimate one who are responsible for this. But at the same time, if there is a legislative approach, there is a legal provision, it can help in that process.
Thank you so much, sir. Sir, I just had a last follow-up on this. So somewhere talking about before we moved on to these building blocks, you mentioned that COVID taught us how engaging community is like very important whenever we are building up any health system or any response. So, sir, in your opinion, how can that community engagement happen from a public health perspective?
Well, so there are, in brief, I will say 2 broad points. One is that, for example, government said that to fight COVID-19, we need to follow COVID-appropriate behavior of face mask, physical distancing, and hand washing, and also contact tracing in all of those interventions. But ultimately, government can only do education and awareness. These behavior will be adopted or need to be followed by community. So, and this will not happen automatically. So like if government tells, okay, you do this, it would not automatically translate. So community should be involved in the decision-making process. There should be sustained dialogue at the local level just to ensure that people adhere to those behavior. One such example of this community engagement is, you might have heard about Harabi Model. Harabi, when the slum in Mumbai, when cases started emerging, people were afraid that, okay, there could be many spread. But slowly, they could effectively control because government officials and communities work together. They garnered confidence of each other. People were apprehensive that if they go for testing, government will pick them up and put in an isolation center. They never wanted to go out of the houses. So what government did? Government set up an isolation facility closer to their houses, the slum. When people were in isolation, when they put restrictions in those areas, the apprehensions of the people were that there would be no water supply, no milk supply, no food supply. And when containment zones were created in those areas, in discussion with community members, government ensured that water supply is strengthened. Government also ensured that food and milk supply continued. So these are the community engagement where government and state and community talk and discuss and identify solutions together. There are many examples in health sector, but this is a really weak area. This need to be done more effectively. For example, the second part is that we are implementing in COVID-19 much of the intervention where government gives suggestion and community need to adhere to it. Similarly, for non-communicable disease, diabetes and hypertension can be prevented by adoption of four healthy behavior. One is a healthy diet. Second is a regular physical activity. Third is no smoking. And fourth is a moderate or no alcohol consumption. So these four are the known principle in preventing non-communicable disease. You can reduce diabetes, hypertension, some extent. But these are scientific facts which people need to adhere. People have to adapt the healthy diet, regular physical activity. Government need to create that kind of environment that there are footpaths. So it's a two-way process. Government need to do something, community need to do something, and that is possible only when there is a trust between the two of them. A little more complex topic to explain in a short this thing, but there are many examples and we will go. There is something called three-way partnership. I have written about this in the book I have co-authored. And some of the details there are there. Yeah.
Okay, thank you so much, sir.
Welcome.
Nishtha, I hope no follow-up now.
No, ma'am.
All right. Ashraf had raised his hand. Ashraf, do you have a question?
Yes, sure. If we are not exceeding the time, I have
You can go ahead.
Yes, I have this one question, sir. Sir, the WHO recently talked about the One Health approach should be taken as a public health policy. So, I just wanted to ask what is the practicality of this One Health approach is in India, and if it is desirable to implement that particular health scheme, that public health policy, how far we are in India right now from gaining that desirable goal.
So One Health is a very important concept, and it focuses upon that human and animal health is very much interlinked. And since you are reading that chapter in our book, the book which I have co-authored, we are talking that the diseases, many of the emerging pandemics are occurring because human encroachment to the forest. So now the viruses and pathogens which were hidden till now in the forest, human beings are coming in contact with them and they are getting exposed to us. Also, we know that the single animal poultry farming and livestock farming, it's called battery farming, where a bigger, like a really large number of a large geographical area, single animal is being farmed. So many of the pathogens which were exclusive for either forest or animals are coming to human beings. So in this context, it's important that we develop an effective surveillance system. Like you might be reading yesterday, there was the first official reported death due to bird flu. Now, bird flu never affected human beings and never caused death in the country. But now situation is coming that this human, animal, and wild interaction is increasing. In that, it's very important that we follow all those approaches. We keep doing surveillance of all the pathogens in different setups and adopt an approach. So it like One Health approach is the right approach where we have a system created and which will be the more or less similar system where the pathogens in animals and humans are identified, the surveillance is conducted, human resources, and the health staff is trained to identify those kind of things, and this is reported in a real-time manner and taken. What is being done as a standalone by people involved in veterinary work and people involved in human health work, both of them need to work together to identify solutions. So it's a good approach. It is catching up recently in India. There is more attention. However, I'm confident that it will improve over a period of time.
I hope, Ashraf, that answers your question.
Yes. Thank you, sir. Thank you so much.
All right. If there are no more questions, Priyansh has. We just have another 6 minutes to go. Yes, Priyansh, quickly.
Good afternoon, ma'am. Good afternoon, sir. Am I audible?
Yes, you are.
Okay. Thank you so much, sir, for having this presentation. I think in such a short span of time, you give a big, complete, overview of the health sector in India. That was brilliant effort. Sir, I have two questions. If you would like to take them. The first question is pertaining to, you clearly mentioned that there are a lot of health policies by the union government in one of your slides, like since 1993 to 2021, the latest one you mentioned. So that being said, everybody in this meeting is aware that the health is primarily a state subject. And what that really may mean is the basically the state is the real, has the actual execution, decision making and law making power. So we can say that central government is more like is an agent of giving awareness and giving money to the states to help them, deal with their health issues. So keeping that in mind, I wanted to know that with this legal background in mind and looking at the amount of health policy the central government has launched, what exactly is the utility of these central policies, keeping in mind that the states are the actual real implementers of they have the real power and they are the real implementers of the overall health infrastructure in the country. I mean, the policies appear more like, empty or let's say false promises without having the power of law or schemes to really give them the force ability. So would like to know your views on the same.
So that's a very good question, but it's a more complex. So for example, health is a state subject, but mainly service delivery. There are few areas like ports or emergencies and other aspect which comes into the central subject. And there are also 73rd Constitutional Amendment, 73rd and 74th on urban local bodies and Panchayati Raj institutions has delegated power to these bodies for public health and primary care. So municipal corporations in urban area and panchayat in rural area are also responsible for some of the health. It makes it a little more complex, but there is a definite role of central government. For example, we know that there is a variable appetite. Appetite means interest in the state government, depending upon their financial capacity to strengthen health facilities. So central government's role is that once such policies are formulated, then it gives a kind of a common framework to the state government to implement those policies. Second part is that central government also runs some of the program which is centrally sponsored and centrally supported. For example, National Health Mission in India, where central government gives a part of money, 60% share, and then 40% given by state government. Similarly, universal immunization program in the country is funded exclusively by the central government. So though service delivery per se is with the state, but there are many components which are with the state government. And that's where the role of central government is and national health policy is. But state government are free to adopt their policy, but they don't have bandwidth, they don't have resources, they don't have priority. So at least it brings attention on those aspects. That's one. Second part is that we know that central government policy and directive automatically gets enforced in the union territories across the country, because union territories are administered by the central government. So its role there. And it gives a shape in that direction. It gives start the discourse. So very important role in the process as of now. And of course, in disasters and emergencies, it's a central government responsibility.
Thank you so much, sir. Just one last final question. So recently, during the pandemic, we have seen how the judiciary has taken over the process has taken the charge of leading the whole discourse towards public health and ensuring that the citizens get their their right treatment in the times of in the pandemic. So recently, a few months back, Justice Chandrachud's bench had appointed a commission, or let's say panel, to look after the oxygen shortage, which was sort of creating the big problem for the people. And it had the best public health experts in India, ranging from the top doctors to top virologists. So my question to you is, why did the Supreme Court have to come in and appoint that committee, whereas the actual power, or let's say the whole, it's the executive who has the responsibility to consult the virologists or the public health policy experts like you, and to engage them in the governance discourse and implement policies and issue rules and directions that things can fall into place. So why did the Supreme Court have to come in and fill that void? And sir, just related to that, I wanted to know what exactly is the role of virologists in the whole governance and the public policy setup in India in comparison to USA, because there we saw even in the public meetings, the virologists used to address the country about their concerns and all those things which were very important to promote the guidelines. Whereas in India, we had the people from Niti Aayog. I think I can't really remember the person, Dr. Agarwal something. He used to be
Vinod Paul. Dr. Vinod Paul.
Yes, Dr. Vinod Paul. Yes. So all those people who are from the bureaucracy and the executive used to have. It appears as if in India the bureaucracy has a high hand in this whole setup. So what exactly are your views and how do you see the current affairs?
Oh, well, that's a very good question. It's a complex one, but ultimately, executive and bureaucracy always have upper hand and they make decision. On this Supreme Court, I believe that courts in this pandemic have placed a very important role, taking suo motu cognizance of everything, including oxygen shortage to death statistics. More specifically, let me advertise my article on this National Task Force on set up by Supreme Court. I have written a detailed commentary which was published in the Indian Express on 11th May. So you can search, where I have raised some of the similar issue that it should be more public health approach and long-term approach rather than medicalization of healthcare services. The role of virologists the role of virologists, because this is a pandemic caused by a virus, so we need one of the member as a virologist, but it should be led by people, a wide range of people, not clinician, and that's a core argument. Unfortunately, when Supreme Court set up this committee, and I have read the judgment or the decision, not judgment, in which the members were selected were suggested by Ministry of Health and Family Welfare, and Supreme Court agreed. Supreme Court had said that we want an independent group of people, but we don't want to get into nitty-gritty of who should be there, so suggest name, and Supreme Court agreed to those names, which were recommended by Ministry of Health and Family Welfare. But please, if you have time, read my commentary on 11th May 2021. It's available on open access in Indian Express. I don't remember the name, but my name and Indian Express on 11th May, you will search, you might find it.
Surely, sir, I'll look into it. Thank you, sir, for your answer. Thank you so much.
Thank you so much, sir. I will hold on my questions for some other session. I'm sure, sir, we would want to have more from you on certain aspects of public health, and then I can open the floor for my questions. But it's almost the time, and I think it's time that we close. I just wanted to thank you for your valuable time and explaining the concepts in such a fine detail. Thank you so much, sir. I am sure by the quality of the questions that my students are asking that they have thoroughly enjoyed your lecture. Thank you so much, sir.
Yes, thank you very much. I really enjoyed the conversation, and I'm impressed with the questions. They were really very insightful. So thank you very much for active listening and active participation. And thanks, Ms. Batra, for inviting me.
Thank you so much, sir. We look forward to another opportunity sometime this year again.
It will be my pleasure.
Thank you so much, sir. Thank you.
Thank you very much, and bye-bye, everyone. Thanks.
Bye.